at LA Shoulder Studios, now brought to you from Simi Valley, California. We left Calabasas. It is no more. But that's still kind of where the headquarters are. So this is episode 7 with my very special guest, Dr.
Leonel Hunt.
Dr. Leonel Hunt. He's a very special guest because he's a good friend of mine.
Right?
He's also a very excellent surgeon from Los Angeles. You've been in practice how many years now?
Going on 21.
21 years.
Yeah.
He's in fact so excellent. He has a show about sipping on excellence where he talks about being an excellent spine surgeon and what it takes to be a producer of excellent work. And a lot more than just that.
Yeah, it's a grind. It's I want to say it used to be a grind, but once you've found your purpose and that love for what you do, then it's not a grind.
I asked you that. I'm like, hey, is this worth doing? And you're like, absolutely.
Yeah.
You get there.
Yeah.
Right away.
It hasn't been work since residency. And even residency wasn't really work. Residency was just busy, but it never seemed like work because you were always learning.
What got it there for you where it was like, hey, this is actually, when did you know this is not work? This is something I like dedicating this much time to, you know?
Probably
Podcasting.
the podcasting.
Yeah.
I would say the podcasting aspect really, it was fun because it's a conversation, you know, and the fact that we talk all day anyway. So it's easy.
You and I hanging out.
Yeah. Figuring out how the conversation's the easy part. The production was the part that, you know, you start out with.
That's the big hill.
You start out with a board and you're just like, I don't know what these buttons mean, so I'm gonna figure this out.
Yeah.
And then you kind of roll with it.
I talked to you first, you know, and you were the one that kind of gave me the idea that it seemed to be something that was doable as an independent surgeon. So the biggest question was, is this worth your time as a surgeon? Because your time, especially, I've listened to your show, Sippin' on Excellence, and one thing I really like about it is you have a mentality on your show where it's really about mentality, right?
Yeah.
It's not just about, you know, you show your results through the work that you do, but the mentality that you have behind a lot of the work that you produce is really kind of the key step to that, you know. And so kind of honing in on that and pushing out a lot of the distraction was something that really attracted me to your show.
Yeah, and the thing is too, with the type of show that it is, we steered away from medicine, and this was my always thought. I was like, if you want my medical opinion, come see me in the office. If you want to hear,
sure.
If you want to hear discussions on life, this is what the podcast is for, and these are conversations we're having anyway. And it's being able to have that conversation unfiltered, unscripted, unedited. You know, our podcast, we just kind of talk, and excuse me, if a few F-bombs get dropped, or like people used to always say, well, you have to edit out the pauses, you have to do all these different things.
People say a lot of things.
Right. But when you edit out the pauses, then it's no longer a conversation.
You lose the rhythm.
Yeah, and you lose kind of the nuances of having a discussion, you know, and that's not what a podcast should really be.
Who came up with the idea behind your show?
Coach. It's interesting. He was in the airport one day, and he called.
What's his name?
Kenneth Johnson.
Coach
KJ. Yeah.
He's a life coach.
Life coach, personal trainer. Known him for years.
Fitness guy.
Yeah, and so.
He's funny too.
Oh, he's hilarious. We call him coachisms, all the little stuff that he says. But we'd be sitting having a conversation, and one day he was like, dude, he calls me up. He's like, I got an idea. We should do a podcast. I'm like, he's like, and we should call it Sippin' on Excellence. And I saw him when he got back from vacation.
It's a good name. I like it. I'm like, yeah,
and
sounds good.
And we were sitting there training. We're talking. I was like, yeah. And as we're giving the audience something excellent to sip on.
Yeah, take little sips. It's
right.
Like, that can't be too much excellence. It's like, whoa, it's too much. Little sips.
Then we should sip on something as well. So we started out the podcast making cocktails every week. And we stopped making the cocktails for the podcast because we started recording during the week. We were recording on Saturdays first. And it's cool, but then we realized we were spending a lot of time on the cocktail in the beginning, like the first 5 minutes.
Yeah.
And then we said, you know what? People don't care about that. We've now developed a following, so now they care about what we're talking about, but they're still getting something excellent to sip on. And even when you bring guests, they're going to give a little bit of their excellence, because I think everybody's got something excellent inside. Most just don't know it.
Well, that's why we drink Mandala tequila around here. Brought to you by Excellent Tequila.
On that note, cheers.
Yeah, cheers to that. Yeah, no, I think the sipping helps, and so the podcasting thing kind of makes sense to either show up in your pajamas or, maybe professional, or, it's nice because it's kind of open to what helps people. First of all, you got to have a point of what you're trying to get across. Frankly, I'm still figuring that out. But what I've realized is with my show, LA Shoulder Podcast, I have really awesome friends that know a lot of really great things that are adjacent to what I do as a shoulder specialist. You're a spine specialist.
Yes.
So you worked at so tell me about the Commons Clinic. Is that a current place that you work?
Yeah. So Commons Clinic is it's a medical group.
It's a group. Oh,
it's
I see.
a group. And so what we did was we came together a bunch of us. I think there's like 17 of us orthopedic surgeons now.
Yeah. The big system. So is this an independent group?
Yeah, it's an independent group.
Yeah, of surgeons.
Of surgeons,
Okay.
which we are all individual entities under an umbrella. And so Hunt Spine is still a thing. It's just under an umbrella of Commons Clinic, like a Commons Clinic affiliate.
I see.
It's yes, I am Commons Clinic, but so is, 17 other guys.
Right. That makes sense, because one thing I've learned with my transition into private practice has really been cost sharing, right? Somebody's got to bear these costs of this giant medical system. And being a surgeon, I show up. I say, okay, guys, what do I need for work? My keys, my phone, and then my license, and that's about it. I show up. Everybody has everything else for me, right? I just got to be there in a good mood and good mentality. And there's so much that happens without us there that there's a giant machine. So we call that overhead. Somebody's got to manage that.
Yeah.
So you can't just do that alone. You can't say, well, I'm going to run all of that business myself.
Well, for 20 years I did.
Yeah, everything. You have to manage a lot of different people and groups and like people that are managing other things. You have to know where everybody lies in that system.
What they don't teach you in med school and residency is the
Besides
business,
any of that?
is the business side of medicine.
Absolutely. Yeah.
And coming out in private practice, you got to know billing. You got to know. Some people used to always say that I'm overinsured because I have an insurance broker that makes sure that everything about me is insured. Dude, I got kidnapping and ransom insurance.
Go to Mexico, you got to have ransom insurance.
And that's where the foundation, that was for the foundation because we travel all over the world. But it's one of those things where you have to know the ins and outs of this business of medicine without letting it affect the quality of care you provide. It's a separate hat. You got to be doctor and CEO without one affecting the other.
Yeah.
And that's a tough thing to do because you're thinking about the finances because you have people that rely on you to eat every day, that feed their families off of you. And as the doctor, you're the taxi cab driver. If you're not in the OR, the meter's not running. And so how do you get all of that to work?
Mm-hmm. Well, go ahead.
And what I found was when I started looking for help to do this, it was more important for me to get clerical administrative help than clinical help. I didn't have a PA or an NP or any of that for years.
Answer the phone, make sure things are organized, scheduling things appropriately.
One of my biggest things was
call people back.
Never have somebody call and it go to voicemail. Mm-hmm. So if that means I got to keep hiring more people, where we both worked at Cedars, in that office space I started out with one assistant, then two, then three, then four, and got up to 5 people. And they're like, well, everybody else is busy, only has 2. I was like, yeah, but I do nothing but practice medicine because they do everything else. Which would you rather do? I'd rather spend that money here so I can deliver this quality care that I want without worrying about is it being handled on the business side. Mm-hmm. And it's worked out. That's why I've had employees for so long. My longest lasting employee's been with me for 13 years.
Did you see a model for that when you're at San Diego as for fellowship?
No.
Did you transition?
Trial and error.
Really, you just started on your own after fellowship in that area?
Yeah, I moved to LA because my brother was coming. My brother moved to LA.
Your brother Gabriel?
Yes.
He's a neurosurgeon.
He's a neurosurgeon, right? Yeah. And he moved to LA a month before me and was hired by the hospital. And so his boss was like, you should move to LA. And I was like, dude, it's like a shark tank up there.
It's going to be work for you there.
Yeah, but didn't know that because where I did my fellowship, they were trying to keep me there.
People think that.
Yeah.
They say things like that.
Yeah, and so
there's always space for good surgeons who do good work.
But in my brain, I was like, I got a for sure job here. Why would I move? And I was like, you know what? This is a perfect opportunity for my brother and I to work together.
Yeah, that's great. That's exciting.
Yeah.
So did you plan that? Did you say when you were kids, all right, you're going to be the neurosurgeon, I'm going to be the orthopedic surgeon? You went to orthopedic training.
Yeah, I was the last one to decide to go into medicine. My sister was first, and she always knew.
You're the youngest?
I'm the youngest. We're all a year apart. And people always say, oh, well, maybe it was in you because of your dad. You know, when you think about it, my story a little bit is...
Tell me about your dad.
So my dad got his MD PhD from Loma Linda and died 6 months after. Yeah, he never practiced. He was 32 at the time.
What was he training in?
Don't know, because he was in med school. He was interested in neurophysiology.
Oh, he never kind of got into his
He died. His fourth
wow.
year of med school, his last year of med school, he was terminal. And so he never really got to even do a residency or decide where he was going to go.
He had you early and then...
Yeah, I was 5 years old when he passed.
So,
yeah. And my mom was a widow at 28 with 3 little kids. It's like, what do you do with that? You know,
kids better get to work, start studying, because that's a tough one.
Yeah, and so it was one of those things where my brother always said, my mom said when he was like 4 years old, he said, I'm gonna be a brain surgeon. Everybody laughed. Who's laughing now?
Yeah.
My sister, me. Honestly, I went to college to become an engineer because I don't know if you remember the old Star Wars movie where Luke Skywalker got his arm cut off.
Of course. And
I wanted to be the first person to develop a fully functional prosthetic hand.
That's a great idea.
You know?
Yeah, we should still do that because there's not a good one.
Right? But that was my thinking.
Yeah.
So I went to school.
I want to have somebody on that can do that, like AI synthetics and figure out new stuff that can integrate with the biology.
So that's why I did bioengineering with material science. Because I was like, I'm going to make that.
Makes sense.
And going through college, I was like, you know what? Here's the perfect opportunity for me to do that. And I hate being in a lab. I like people. And I've already did the prereqs for med school. I was like, I'll take the MCAT. If I do well, then I'll go to med school. And then I'm like, if I apply and get in, I'll go. I applied to 4. And I was like, all right, I'll go if I get in. And then it was a matter of who's going to pay me to go. And when I say that, because I got a full scholarship to college, I was like, it'd be nice to get one to med school. And
that mentality, you can achieve that.
So I ended up getting a full ride to USC for med school. And so I was like, I guess this is meant to be, and fast forward, here we are having this discussion.
Well, you put it in, you put the time in, and you had the will and determination. You listened too. You listened to what, kind of which way things were going and what made sense for you. And that's what I got too from your podcast, is that you really kind of live your life that way.
Yeah.
Kind of very deterministic in a certain way, but I think that keeps the peace, or
keeps the peace and staying on purpose.
Yeah. Do you exercise as well?
Oh God, at least I weight train at least 3 days out of the week, and then I try to get cardio in at least 2 more days.
What do you do for these long days in the OR? I mean, some of these cases are 12 hours. Do you prep? Do you pre-work a stretch? Do you do any kind
Not
of
at all. I just go in and hope for the best.
Just keep going. Just let your neck kind of hang there.
Yeah. I have it's funny, in my office at home, I have a rower. And so I'll get up in the morning before work, and it's 10 minutes on the rower, but that's 2,000 meters. You go.
Rower's great.
The rower's great.
Yeah, I like
and
the rower.
If I can't do anything else, I can at least get in 10 minutes.
Yeah. 10 minutes of good. Yeah, I do the Peloton for like 15 minutes, maybe 20 minutes if I have time.
Yeah, because the thing is,
you should be able to work out for 20 minutes.
Come on. You should be able to squeeze something in.
Something.
And, as surgeons, we're so busy.
Yeah.
It's like you either make the time or you don't.
I want to ask you some questions, because this is kind of like fitness, especially like LA, the type of patients that we're seeing.
Oh, for sure.
There's definitely a significant fit population, and I think that patients can identify with us. You're a cool guy with a cool name, Leonel, you got cool tattoos. I have tattoos, and patients see us and they listen to us these days. They're listening to podcasts. I kind of turn them on to things, and because people want to know good information. If you can guide somebody with good information. We're 2 surgeons, doctors who are board certified. We're doing podcasting, but we have credentials, and
has anybody ever given you shit for your tattoos?
My chairman at USC, Jay Lieberman.
But patients,
He
no.
smacked me and he was like, "What the hell is that?" I was like, it's like, "When'd you get that?" I'm like, I've had it for years."
Have patients ever said anything to you?
They notice them, but
Yeah.
they usually are kind of admire the work. Usually they want to see some of the work, you know? And
me.
so
I can't.
yours is nice
I
too.
can't hide mine. I got.
No. But if you
17
put
of
it in front of their face, then
And so when I wear scrubs, they all just look. But and the funny thing
that's
is,
why I ask you, because it's more here,
Yeah.
it's out there. Mine are a little more covered, but not that much.
I'll tell you why. There was a 10-year gap between the one here and these here, because I said I needed to be far enough along in my career where stereotypes didn't matter.
It changed over time too.
Yes.
Yeah. You've changed a lot of stereotypes that people may perceive as a person,
Yeah.
a different, a guy, different type of person with tattoos. Like, people make judgments on that for sure.
all the time.
And then it's how you look. I used to have long hair and I used to get in trouble all the time when I was younger because the cops just looked at me like I was a troublemaker, and half of the time I was probably doing something I shouldn't be doing, but most of the time I wasn't. And then, you kind of realize like your appearance is important, and it's significant. It should be something that you consider. And it doesn't mean you have a way that you should look or shouldn't look, but I think you should just be aware of how you come across.
Here's the funny thing. The people who question my, not necessarily abilities, but my credentials and me as a doctor, because I have tattoos and look the way I do, more were people who look like me than those who didn't look like me.
Mm-hmm.
Kind of wild, right?
Mm-hmm.
You would think, oh, the older white guy or the older white lady is going to come down on me because I have all this. Mm-mm.
They're usually like totally.
It was people that
non-judgmental.
look like me who expected me to walk in being white with gray hair.
Mm.
And then when they see me, they're like, oh, I don't know what's going on here.
Hey, I'm the one that showed
Right.
up. You're the one that has to make your
clearly,
assumptions about me.
Right. And it's one of these things I'm like, you clearly
Sure.
didn't Google first.
Yeah, I look young. It's like, well, you look younger than your picture. It's like, well, do you like me? We'll find out. But hey, we're here. We're all here.
Right. I had to tell one patient, we're either going to talk about your back or we're going to talk about my tattoos. We're not going to talk about both.
We have this much time.
So you decide how you want to spend this time of yours.
Most people do want to spend kind of catching up on things.
Oh, for sure.
For
And
sure.
it's okay.
Whatever
but
they want.
I want you to get that personal relationship.
Yeah.
But just know, I also want to talk about your problem.
Yeah. Oh, for sure. And that's going to be curious for me to kind of see how my time is managed differently and, in the private practice setting, because I'm going to get things are kind of planned and getting things going, but, it's still me and it's still the work that I do and the patients are still the same and I'm treating the same problems. It's all the same stuff.
I think the key is giving them the perception that they're spending more time with you than they really are.
Definitely.
You could spend 5 quality minutes.
Yeah.
And come out on top.
I enjoy spending time with my patients.
For sure.
We were talking about how fit they are,
Yeah.
and I think a lot of people that are fit it pushes you. This guy over here, he doesn't look like much, but he knows jujitsu. Yeah, I got him training jujitsu, and so we used to wrestle each other in the OR and put each other in headlocks. And so I actually changed.
I'm sorry, man.
Yeah, I beat him up a little bit.
I know.
But so he learned jujitsu for a while and he got, he learned enough, but the patients that we interact with really, when I started training, it kind of pushed me to a level that even though I played sports, football, working out, lifting weights, but competitive like martial arts, really like kickboxing or karate, any of that stuff, it pushes you, and so it's something that you can do consistently. Patients in LA kind of they'll ask with similar mindsets of like, how do I get back to that high level of sport? You may not be an MLB pitcher, but you're playing at a very high level or you're participating at a high level. Have you seen a lot of issues or patients coming to you with questions about testosterone?
All the time.
What do you think about it?
I think what we need to realize, tell people,
TRT, testosterone replacement therapy.
I think it's great to get you to a normal, not a super normal state. A lot of guys have a testosterone of 400 and want to be at 800. You're 60. No,
natural decline.
And I
senescence.
think also if you are,
but trends.
Yeah. If you are hypogonadic and you have a testosterone of 50, 75, 100, you want to replace your testosterone so you feel human again. And it never really hit me until I went through
yourself.
Until I went through prostate cancer treatment. And in order for me to be cured of that post-surgical, I had to be stripped of testosterone completely for 6 to 8 months. Having a testosterone level of 0.
It went down to 0.
They had to, completely gone. Because prostate cancer feeds off of testosterone.
Your skin got really soft though.
Got really apathetic,
yeah.
got really tired all the time. You know.
For how long? 3 months?
No, almost a year.
A year, wow.
Work out as hard as you can, and you put on no muscle mass.
Build.
Everything you can't. Not only do you not build, you
can't maintain.
You can't maintain it all, and I can only imagine what that's like as an everyday, all day thing as a man to have no testosterone. And so I'm all for, because think about it. What does testosterone do? It's a healing block. I mean, you're not going to get an older man to recover well from anything you do to them if their testosterone is low. And so it's that fine balance of how do I give them enough? And so I tell people, have a good functional medicine doctor on your squad.
How do you find one of those functional medicine?
It's
like endocrinologist?
It could be anybody. It can be
internal medicine.
My sister, family practice, was a functional medicine doctor.
They can just manage those types.
They can manage. It's basically looking at everything in your body that we in sort of traditional medicine ignore. You know, because our whole system is a chemical balance.
Does your sister have a website?
No, my sister doesn't do that anymore.
Oh, she doesn't do that practice.
No,
there's a huge market for that.
Oh,
though.
huge.
Functional medicine, health,
huge.
fitness.
Yeah.
I mean, look at the stuff RFK is doing. And I don't think they've really given it enough attention and studied it enough. And the government's got to fund this and say, hey, this is important. Let's look at this.
Yeah, the government's never going to fund it. Because
little steps. Something.
Yeah, because also with that balance.
It's going to help too much.
Not only that, but with that balance, you take it too far one way, then you start seeing the deleterious effects of too much testosterone.
Yeah.
You start creating, gynecomastia. You start seeing the change of testosterone to estrogen. You start seeing hypogonadism. You start seeing, but there's one thing that people always said that I think is kind of bullshit, and we'll kind of figure that out soon, is that putting people on testosterone post treatment for prostate cancer increases the likelihood of recurrence. So why doesn't your natural testosterone cause that? So now they're starting to realize there's no higher incidence of, now somebody like me who had cancer, it recurred. I'm probably not going to test those waters. I just let my testosterone go where it goes. And then there's the natural supplements, the ashwagandha, all these other things that can naturally, and what most men don't realize, you want to raise your testosterone, go pick up some heavy shit. Go lift some weights.
That's what stimulates the production.
Yes.
Yeah.
Do that.
Good intake and then stimulate it that way.
And
because
vitamin
a lot
D.
of those things are releasers. They can increase the released amount of active testosterone, but everything else is bound up.
Yeah.
So you're just getting a short-term effect. You're not getting a long-term benefit. Lifting weights and having a good exercise and diet program
and then people forget about the precursors. You got to take vitamin D.
Yeah. Vitamin D, go outside.
Yeah. And that's still not enough. You got to take some
constantly management.
I take 5,000 to 10,000 a day. It's just, you just got to.
And multivitamin.
Yeah. You got to stay healthy. Stop doing bullshit.
It changes. Look at how good your skin looks.
Man, that's just because black don't crack. That's just that and some lotion.
Keep it nice that way. But it's good. It's like the more you look into it, the more you realize, hey, we don't really know. And what we've been told maybe is not exactly right, because what is right for you and what is right for him, and it's got to
be individual,
and it's constantly dynamic, right? It's like one day you might not be taking your collagen for a whole week, you're going to have an effect, but if you've been taking it, you're going to have a different change in things, and then that changes over time. So it's really, really complex. And so what got me thinking about it a lot more was my kids. And kind of thinking about all the dyes, and I cut all the dyes out. It's totally calmed them down. I cut anything red out of their diet. I don't really eat it, but they still eat the packaged stuff, a lot of sugar, and sugar is like its own thing, its own problem. But when you combine it, it makes it like crazy. It activates your brain in weird ways.
But sugars also, natural sugars.
Makes you addicted to it.
Yeah, but you have to separate out the processed versus the natural.
For sure.
Because you think about it, what does the brain use for food?
I used to not think that was a big deal, but of course this is a big deal. It connects those things in your brain. It associates them.
One of the things that really made me understand how sugar or carbs are important is my brother and I decided one day we're going to go completely keto and no carb and go carb free. And we're going to see who can last the longest.
You feel a difference big time.
Brain fog,
Diarrhea.
like a champ. Yeah. But it was just, I started feeling slow.
Yeah.
And I was like, because I'm not feeding what my brain needs. So when people say I'm going on a no carb diet, okay, because you really don't need to be a thinker, because you clearly, there's something up here that was missing. I lasted 3 days and I was like, I just need a slice of bread, something. And then I realized, okay, this is the important stuff. I think on the healing journey after surgeries, what I tell people too, people always ask me, well, how do your patients respond? I'm like, everything's different because like we were just talking about, your environment plays a role, what you put in your body. I can't tell you that you're going to recover from surgery the same way he will, even if I do the exact same surgery.
We're doing surgery on one day. You're living your life coming into that. You've lived all this time. You're eating and doing different things. We do the surgery at this cross point in time. And then you go on and then you do your whole recovery on your own and do the same thing again over all this time. Even if it's 12-hour spine surgery, how critical that is. And it matches the amount of time that of importance, right? Like the surgical intervention. But then all the other stuff is just as important, and it can change your pain. There's more on mental health and outcomes and psychosocial factors of like prior trauma, what you think about going into surgery, being scared about the pain that you might have.
Setting expectations.
Yeah. How does that, so setting expectations, and how does that play a role in how you counsel your patients about a giant thing like spine surgery? Even if we're doing it outpatient, hey, come in and go home. This is a big deal. You're still having spine surgery.
Yeah, I tell every single patient, this is going to hurt. So many spine surgeons are like, oh, it's a simple surgery. You'll be fine. If I tell you, no, you're going to be fine, but this is going to suck for a little while. You wake up from surgery, you're expecting it. If you're not miserable, then I was wrong. Great. I'd rather be wrong on that side.
Hey, pain's not a requirement.
Right. Than be wrong and say you're going to be fine and then you're miserable,
For sure.
And so I try to tell them, look, you have to take a part in your own recovery. My part's the easy part. You healing from this is now up to you. Excuse me. And so that, to me, is the biggest aspect of setting expectations.
And it puts it on them too, to really have accountability for their own actions. It's not just Dr. Hunt. He's such, an excellent surgeon. He's going to fix all my problems and then that'll be fine. They have to know it's just as important what I'm doing. I'm listening to him. I'm getting up. I'm doing the either stretches or no stretches pretty much, but you can't just lay in bed all day either. No. These are things that we've learned over time and we've studied, and the problems happen, the DVTs, the blood clots, and it's like, hey, the most important thing for grandma to do is get up after surgery right away. Up and move. Get up and move for sure.
And I always tell people, surgery doesn't make you perfect. It just makes you better. And it doesn't always make you better. Even if you're better 99% of the time, that 1%, if you fall in that 1%, then it's 100% in you. So I tell patients all the time, here's a question that I always ask. Number one, can you live with this? With where you are right now, can you live with this? I didn't ask you if you wanted to live with it, but can you? Number two, are you willing to risk being worse for the hopes of being better? If you say no to I can't live with this, and yes, I'm willing to risk it, then we have the conversation of surgery. I can't tell you how many people change their mind about surgery once I make them answer those questions, especially these older patients with these big scoliosis.
Would you say that you would have the same conversation with a person who has never had surgery and has had chronic pain versus somebody who's had maybe one or two multiple prior surgeries and has the same pain that never got better? Would you have the same conversation with those patients?
Yeah, but I would tell them, here's the likelihood of you've had 5 surgeries, back surgeries already. And the reason why I bring that up, because I've had somebody last week with this. You've had 5 back surgeries already. You want me to be number 6 when the first 5 didn't work. You still have back pain.
Let's find a really good new reason that it would make sense for it to get better this time.
Let's find out, number one, where your pain is coming from.
Yeah, let's find out, because it doesn't seem to be that we have a correct diagnosis.
Instead of just looking at the tree, take a step back and look at the forest.
Yeah.
Because what happens if you have an underlying autoimmune disorder that just keeps inflammation in your body?
Something else is explaining the problem.
I'm trying to fix the structural problem when that's not the source of your pain.
Exactly. and you're going to do a structural solution for a systemic problem.
I like to think I'm more than just a mechanic,
Mm-hmm.
you know, and so I try to take that step back and say, okay, if let's do 4 weeks of whatever this is, you've had pain for 20 years, 4 more weeks isn't going to kill you.
Mm-hmm.
If I'm wrong, then you're right where you are today. If I'm right, but if I rush you into surgery and I'm wrong, then you're worse off.
We made the wrong decision together,
Yes.
maybe, you know, and I think that's hard to admit sometimes. And I think it's very rare when that happens. But when you get into that situation, sometimes it happens because people don't get better. So maybe let's find a solvable problem where we can both agree as we move forward with this treatment, you're going to get better because that's what I want and that's what you want. But we got to agree on, I say diagnosis first.
Yes, 100%.
You got to establish that.
What's
that
the problem?
You believe that shoulder for me, is,
Right.
you know, and for you, it's less, it's less like, it's just my back, you know, it's like in my leg, you know, my foot's numb, you know, and it's kind of like mysterious.
And like you said, for your shoulder,
what is causing that?
Is it actually your shoulder or is it your neck?
That's the interesting thing. I thought that the overlap that you and I, and that was really why you and I became initial friends, is we were referral colleagues to each other because I had so many people that had clear neck problems. And I pride myself as somewhat of a diagnostician. Jason Berkeley, he says, you, Stone, you send me the people that you put it on the referral, look for suprascapular palsy, and it's a palsy of that nerve. He's like, it's funny because, you know, I tend to try to use that as a diagnostic tool, you know, and I think you can use EMGs differently, nerve tests. He actually did my EMG recently. I was like, oh my God, this is a little rough, but not terrible. But same thing, if you think it's going to be terrible going in, it can be really rough. But that part of it wasn't too bad. So the overlap between spine and the shoulder, I think, is fascinating. I actually was going to be a spine surgeon. I was a member of NAS. I might still be a member of NAS.
Like I might still be.
When I was a resident, I did doing some spine research and stuff, and I was doing labs. I was just very interested in it. And I think part of the interesting thing for me, our patients tend to be pretty similar and kind of like their thoughts about their complaints or their problems, but because of that overlap, the nerves in the neck can really recreate a lot of symptoms in the arm, you know, in the shoulder even. And so sometimes it's hard to tell because your shoulder problem can then cause your neck to be really stiff and tight. You know, the muscles can spasm, and then that can cause nerve symptoms sometimes even in your neck if you're predisposed.
Yes.
So that overlap is that kind of link that I have to figure out a lot of the times. And sometimes you go and you see a doctor, it's like, oh, that's not my issue. It's like, that's not that. No, go see this guy, whatever. It's like, don't, you know, it's dismissive. You know, for me, somebody comes in to see me and spending that time, and I want to give them an answer, even if it's not, hey, it's not a shoulder problem. This is great. Let's high five, but go see Dr. Hunt. So what do you think about working with your colleagues and about the importance of having close communication with somebody like me, a shoulder specialist? Have you learned from me? I know I've learned a lot from you.
For
just
sure.
Like what is
I mean, there's a
right to
couple
say?
patients we've bounced back and forth where, dude, it's her shoulder. And you're like, nah, dude, it's her neck. And it's been a back and forth. And we're like,
I'm like, I'm not making her shoulder any better. So something else is going on.
You're like, the parts that were her shoulder are now better, but she's still complaining. And for me, it's allowing me to learn more. And I'll tell you one of the simplest things that has made me separate out neck and shoulder. If you move your shoulder and it causes pain, it's not your neck. If I can do this, then the problem's not the neck causing the shoulder pain, it's the shoulder causing the neck pain. It's very specific motions. Because neck problems that cause shoulder pain hurt when the arm is down, feels better when the arm is up. When it's a shoulder problem, it's the opposite.
Shoulder problems hurt up here.
And are better down here.
Right.
And if it's a cuff, inevitably, biceps tendon is going to be sore. If
Definitely.
I touch it,
biceps get stressed because of that.
if I touch it and it hurts, that right there, when patients are like, it hurts right there.
It's almost 50%.
That's not your neck.
It's about 40%.
Yeah, I was going to say, that's not your neck.
Very
if you can
common.
point right there and say this.
Totally. That's anatomic based. This means shoulder pathology.
Yes, right there.
Yeah.
When they do this, which is, for those who can't see me, when they stroke the side of their neck and kind of do one of these, it's one of two things. It's either, C5-6 or
radiculopathy.
right, or an impingement.
Yeah. And weakness, yeah, and the impingement is a real thing. I used to think that it didn't understand impingement, but I think things just get inflamed and it gets tight in susceptible people. And you get it on one side, get it on the other side, but it typically doesn't happen at the same time. Central issues can happen at the same time, right?
Yes.
Radiate both upper extremities, right?
And if patients are walking around like this, that's not shoulder. They're walking around holding the side of their neck, that's not shoulder, regardless of the shoulder pathology. And it is possible to have two problems. Yep. Everybody wants to say it's your shoulder and not your neck, or it's your neck, or they'll, because I've seen some crazy spine surgery out there. People will have a small disc bulge at C5-6 or C4-5 and be like, we have to fix that. We got to put an artificial disc in because your shoulder hurts. Did you ever do a shoulder exam? And it always amazes me that orthopedic spine surgeons won't do a shoulder exam. I'm like, you're an orthopedic surgeon first. At least do a Jobs test.
Yeah, yeah.
You know,
well, then you
do
have to
that.
document it. Right. What was that, Jobs? Yeah, I think it was Jobs.
The empty beer can. Try that.
Just remember that one.
Just do
beer
that.
Can, yeah.
Just do the beer can. You
if
don't have
it's
to do nothing
weak
else.
too. The weakness thing is interesting because I find that those are the biggest discrepancies are people that have weakness, because those are the functionally limiting problems.
Yes.
If you can't lift your arm up. And nerve issues can be very, very specific but fickle. And there is a lot of overlap in those muscles. But also, if the neck is an issue and your shoulder is an issue, there may not be any good overlap for that. What do you think would be the next frontier? We talked about digital Luke Skywalker hands. In terms of regeneration, in terms of, is it going to be something biologic or is it going to be something technology based that you think will be the next frontier for spine?
Prevention, I think, is the next frontier.
Yeah.
Because you can't turn back the clock. You can't turn back the clock. And so understanding why we get problems in the first place, and I think one of the best things ever invented in recent times, standing desk.
Definitely, based on that study.
The standing desk.
The sitting study where all those medical students, they poked them and then they had back problems.
Well, but the thing is, we know, if you think about it.
Because sitting has more spine, right?
Yeah, when you're sitting on your pelvis and spine. There's no force distribution anywhere else. When you stand up, that force distribution goes through your hips, your legs, and your pelvis, and your spine is carrying less of the load. Yeah. You sit down, and people who sit down all day, that's why when...
What if you sit like this?
Yeah, same thing.
It's worse.
Worse.
Yeah. I sit like this all the time.
And I say the second thing is getting people to... I think one of the worst things that's happened to us was this. Tech neck.
The shoulders, too.
Tech neck is a real thing.
People with shoulder problems because they're always on their phone like this.
Tech neck is a real thing.
Totally. My boys are having trouble with their eyes because they're on their phones too close.
Yeah. And so I tell people all the time, we have a supercomputer in our hands.
Yeah.
We didn't have problems. First, it was we're holding the phone to our ear like this, and everybody's developing. And so then they got earpieces and using laptops, which was okay, but people were getting a lot of carpal tunnel. We started taking everything from the laptop and from the desktop and putting it in the palm of our hands, and we spend more time on our phones than we do a computer. We're now getting tech neck, and everybody's like, why am I getting that hump in the back?
You got to get one of those neck stands that holds it up right here. And so
or
walk around
people think because the phone's down, they have to move their head down.
Right. Or you just use your
tilt
eyes.
It.
So
all you got to do is this. Just tilt
texting.
it. Right. All you got to do is tilt it up. Just tilt it up. You know, tilt it up and look.
What's the best way ergonomic position to text as a spine surgeon?
Just like this. Have your phone at a 45-degree angle.
Right here.
Instead of flat.
Gentle rest.
Just like this. And you can do this all day. My head is in a good position.
I feel pretty good.
And I'm just looking down.
Yeah. And then kind of far away too, so you don't strain your
wherever.
hips.
And as you get older,
it
goes further and further away.
Farther, sorry.
Right. So it's just that overlap, and we're starting to see a lot of neck problems because of that.
Have you embraced new technology?
Oh yeah.
Yeah.
I would say.
What's the latest, coolest thing you've embraced that you think has helped you as a surgeon? Or
definitely robotic navigation.
Yeah.
Yeah.
What describe that? What's that?
So, I was always this purist of I can do it anatomically without needing with just X-ray and go. And then there was never a good 3D navigation that I thought was great. And then all of a sudden now, transition to the past few years, there's been this change where we can do image guidance and place implants. Not necessarily perfect, but damn near close with assistance.
And confirm the implant
was placed where we wanted it. Yeah. Yes. And so that is probably one thing that's changed. And one of the other things that one of the other things that I see too, which is something I'm working on now because of ergonomics, is digital loops. So I'm working with a company now where we're designing loops that I can magnify up to 10x. So basically putting a microscope on my face. And
let's start from a resting position that I'm comfortable with.
Yes.
And go from there.
And so it has the ability to range from a -10 all the way. So I can move it like this digitally and it be in focus the entire time. And
are you
we have
developing that?
Yeah, we have the ability to go all the way up to 320x. So we can see almost on a cellular level digitally in 4K.
Microscopes are cool.
Yeah. And so, but what I've noticed too with the microscope itself, on certain cases, because the way the eyes are set up, I'm leaning back, and so now I find myself during a case kind of doing this, arching my back, and I'm just like, we got to do this better. And our loops that are just at a set height,
but you're paying a lot more attention to it now.
Yeah, and that's the key, because we as surgeons, we got to get longevity out of our careers. And
I think the only way to do it too is by paying attention to the weird things that you're doing. When you're, for me, doing a shoulder surgery, I realize I'm in a weird position. I have to put my head down sometimes to kind of see inside the glenoid. I have residents around and
Right.
people are retracting. It's like, okay, you just have to move out of the way. I'm sorry, but you just have to do it. But regardless, everything still hurts.
Move the patient to you.
Yeah, constantly. Having to adjust, but it's kind of an art of figuring out which parts are causing problems. Because it's kind of a dynamic thing where in spine you kind of enter into that position and then you do a lot of work from that position.
But also noticed how I'm standing, because we're using a lot of foot pedals.
Yeah, how you're starting, where
the X-ray. So the technology of navigation and robotics means less C-arm, less fluoroscopy in the way. I found myself always standing on my left leg, developed varicose veins around my left knee. So I started switching the foot pedals over. So I'm standing on my right leg and using the left leg to use the foot pedals. Varicose veins got less.
No way.
Yeah.
Oh, they got less?
Yeah.
Oh, wow. So you can balance it out that way.
So
you don't want to stress your body when it's more stress, and then it can fail.
Right. So I started flipping things back and forth, so that way I'm not doing one thing on one side of the body too often, and just taking those moments of breaks and just like, all right, let me step back, move a little bit, and then come back in and get set. I'm not racing against the clock. It's getting something done in an expedient fashion that's going to be best for the patients, but also best for me.
What do you think the hardest physical part of our job is, or your job is? Like, what has changed over time that you think was, for me, when I was younger, I just was not paying any attention to those things. And now I'm paying attention to them constantly. It's only been 5 years of practice. I'm in my 6th year now, 5 years of residency. I didn't even think about it.
Right.
Fellowship, I'm only thinking about trying to do the surgery perfectly. I'm not thinking about those other things.
Right.
But then you start developing that over time. When did you start noticing any kind of problems? Did you notice like early on, this was something I got to be aware of? Is this something somebody taught you?
No, I wasn't aware of it till it started to ache.
Aches.
It's like,
as an attending, that's why I started hurting.
Yeah. Didn't notice it as a resident. Didn't notice it as a fellow.
Right.
And probably didn't notice it my first 5 years in practice, because I was just like, I'm 30 years old.
Juiced up. Let's go.
Let's roll. I'm young.
Yeah.
Now at 52, I'm just like, you know what? I got to do this a while longer.
Yeah.
I want to do this a while longer. How do I protect me?
Right.
So I don't end up on the opposite side of this equation.
Yeah. Let's keep these wheels on nice and tight. Keep it rolling.
For sure. The other thing too is we use a kerosene a lot.
Yeah.
One thing that saved my hand was the pneumatic kerosene.
Do you use the pneumatic?
I use the
one?
pneumatic kerosene.
That makes a lot of sense.
Oh, yes.
Yeah.
And use the drill a lot more. So that
Carpal
way.
tunnel, big time.
Carpal tunnel, basal thumb joint arthritis.
Have you had surgery?
Nope.
No orthopedic surgeries?
No orthopedic surgeries.
Dude, I've had
broken
tunnel.
stuff.
I've had carpal tunnel. I've had shoulder surgery.
Yeah, I haven't had any of that. Like right now.
You've broken stuff. But you heal well.
Oh, playing football, broke this hand in 5 places. Just.
Did you play high
places.
school?
Yeah. And it was just little stuff.
What position?
Defensive back. I liked hitting people, not getting hit.
I was a linebacker. Yeah, so we would have been on the same side. So I want to ask you some questions about, we talked a little bit about technology. One thing I wanted to ask you about was biologics. I think
Yes.
the topics of biologics has always been really interesting, especially in spine, because you need to get bone to heal. You got to get it to fuse. But the issue of soft tissue biologics for sports surgery is also an interesting facet, but where you have to harvest these mesenchymal stem cells, the MSCs, comes from the bone.
Yeah.
Right. So how much do you use biologics in your practice? And what is that? What does biologics mean to you?
Biologics for me is more aimed at I got to get the spine to fuse, and I got to get it to do it quickly and causes little harm to the patient. So
You think fusion, bony fusion?
yeah, because that's the only time for me surgically where biologics matter. I think the human biology or the patient themselves, their healing has so much to do with how you handle the soft tissues during surgery. And this is what I try to tell the residents. Pay attention to how you use the bovie. Pay attention to how you're holding the soft tissue skin on close.
The lines, the planes you're cutting,
Yes.
how you're retracting,
You
if
know,
you're damaging,
and I
causing
tell
more
people,
trauma.
the less things you do to a person's skin and muscle, the higher chance of them having a good outcome. You keep grabbing the edges of the skin, that's avenues for infection. You keep, so there's these little things, and then the patient themselves, if you can hold off on their surgery and tell them, hey, I need you to do everything you can to be nutritionally sound before this surgery.
I think that is key.
Stop smoking. If you're a diabetic, get your sugars under control. Drop that hemoglobin A1C. Drink plenty of water. Don't come to the OR dehydrated, So all these little things that are going to give you the best chance at healing.
Do you use any nutrition optimized plans or use any kind of supplements that you recommend, XR nutrition or anything like that?
No, because there's no one out there that comes that I can say has great bioavailability. This is going to do you great. So I always tell patients,
You should try XR. XR nutrition is really great.
Really?
I had him on, the founder,
okay,
Reza Jazieri, on the show, episode 5.
okay,
And it was,
yeah, I think you sent me that clip.
Yeah. So I've been using it. I tried it for my own surgeries, but it's the stuff you need. You go work out, you need the stuff, right? Creatine, you need your zinc, you need all the vitamins. And like we were talking about, you got to have all the things. It's just in a package. And then there's a plan. You just take it a week before, 2 weeks after. That I think can have an effect.
Well, I think this
around that
goes,
time.
I think
Fills
this
in those
goes
gaps.
into where I think medicine should go.
Yeah.
Is personalized medicine.
Yes.
So
let decide. Look, go take this if you want it, but these are the options. I find myself being the one to give my patients the best options. Here's the best ice machine I can find. Here's the best nutrition plan I can find. That's why I ask you, do you have any kind of like plans like that you use specifically? I've been developing these things over time and kind of seeing how it's having an effect. It's not going to change things in 20 years, but some of the
Right.
research is showing by 1 year, you might be better off than the people who didn't get it. And then at 2 years, you might actually still be a little better off. So it's like, well, then at which point are you going to be optimized? And at which point are you going to avoid complications if you say, I'm 10% better? So grandma's going to avoid that 10% risk of a fall that could cause another complication. And then if you just do it a little bit more, maybe everybody's a little bit happier, less pain. I've seen a significant difference by having a change in nutrition and what I recommend for my
yeah,
patients.
and I think it boils down to compliance.
Definitely. Compliance,
Patients-
for sure.
You have to
Making
make
it easy for
something
them.
easy for them.
Mhm. And telling them what you think is important.
Right.
It doesn't matter.
The things
Maybe
the
not.
things that I tell them, are a lot of it is, okay, before surgery, I need you to lose some weight. I need you to stop smoking. I need you to think about your alcohol intake. I need you to increase your protein intake because you're going to need that to heal, wounds, your soft tissues, all of this stuff. But it's hard to tell them exactly what they need when you don't know what they're missing. And this is why, if I had a perfect world, I would have a functional medicine doctor attached to my hip. And
Check everyone.
a functional medicine doctor and a pain psychologist.
Mm-hmm.
Because every patient would see a psychologist and a functional medicine doctor and a nutritionist before surgery.
How do we set
single
that
one.
up? I think that's a good idea. Who do you know? Let's get
That's
some
the hardest
people.
part.
Let's get some people. We can start a little
need to.
group.
And just
and then
cross-refer.
It'll be a little model.
Yes.
And then you use that because I think that's emerging. That's so important because it's nice to hear you as a certified spine surgeon who's practicing current state-of-the-art medicine,
Yeah.
as am I, but we're paying attention to these things now because I think there's enough importance to say, why not? It's not hurting. Maybe it can help. But some people may say, well, how much money are you making off of that? Right. And then it's like, well, there's a lot of different ways that we are helping our patients and that different types of products can help our patients. But I think that I'm not making any money off of nutrition.
Right.
I would love to, but I think that as of right now, it's kind of like we don't really know how much of that is going to be an effect. So I'm just trying it out myself. I'm taking that stuff all the time.
Right.
I'm buying it myself and I'm using it. And I think people like Huberman, the podcasters who are scientists who have the credentials, and then they're doing the N of 1 studies and saying, let's just try it out because I'm going to recommend it, but I'm going to recommend it with reservation.
I think the biggest issue that we are going to face with this is that there's no money in prevention. Or should I say, the insurance companies and the healthcare industry doesn't make money off preventing illness and injury. They make money off treating it. And so for me, yes, people are always like, you're the only surgeon I know that doesn't want to operate. I was like, it's not that I don't want to operate. It's just that I know what happens. And I can make an argument to operate on every 30 patient that comes into my office every Tuesday and Thursday because everybody's got something on an MRI. How can I take that person with back pain, still capture that patient, but give them this option of nutrition, getting their functional chemistry in check, setting them up with a good personal trainer, not just physical therapist, and seeing if I do all of those things, can I prevent you from having surgery? But still, because they're under my umbrella, can I make a living doing that as well?
You can still help people manage their lives and make surgery an option that they may consider later.
Right. Fail this first, then come talk to me.
That's why your patients love you.
They
would just always tell me how much they love you. It just could go see Dr. Hunt. It's like, I already have an appointment with him.
Here's the funny thing. I had a patient yesterday who, on Thursday that I booked for surgery, and she was like, you're my third opinion. And I went online, and everybody's looking at reviews now, right? And she's like,
I looked you up, Doc. I looked you up.
She's like, the funniest thing.
It's all true.
She's like, the funniest thing. She's like, the funniest thing I saw
Yeah.
was that all the bad reviews that you got, she's like, they all said the same thing. He didn't want to operate on me. And she's like, I couldn't tell why that was a bad review. And I was just like, because I want people to know.
It's a big deal as a spine surgeon to say no.
Yeah. And so they were giving me bad reviews because I refused to operate on them. I'm like, if I don't think I'm going to help you,
it's going to happen.
Go see somebody else. And so the goal is, how do we?
It's critical.
How do we collaborate this?
I think if I think this will help you, or I don't think this will help you. You just have. They're sometimes not prepared to listen to that, or it might not be the right option right now. Maybe someday something will change.
And something that people don't
right
take enough advantage of, every single patient that walks in my door, I set them up to get an acupuncture.
I love acupuncture.
Every single patient.
You can reorient things, reorient how you think about pain.
6 weeks post-op, 6 weeks post-op, everybody goes for acupuncture.
How often do you do acupuncture? Once a week?
Depends on the acupuncturist. I send them for twice a week first, and then let them decide what they need for maintenance.
Do they do a specific kind of focused exam and then they'll do guided treatment?
Yes, they all do. I'm a firm believer, and I'll tell you my anecdotal story. After I went through cancer treatment, I started getting cluster headaches, and I was ignoring them for years because I was like, I get through. Then
what were the symptoms with that?
Cluster headaches, basically, it started with my left eye would twitch. I'd get a ice pick in my forehead right here. My scalp would burn, my teeth would hurt, my eye would water, it would turn red, I'd get congested on this side of my nose, and then it would go away. And that would all transpire over 20 minutes.
Whoa.
Yeah. And it would
When did that start? How old are you?
It's been going on. It started probably in my mid-40s.
Oh, really?
Yeah.
Wow.
But it started after I finished treatment for cancer. And so I never knew what was causing it. I just ignored it. Then it started happening at 2:00 in the morning every night, and would wake me up. And I'd go tool around my house for 20 minutes.
Was it from chemotherapy?
Don't know, or hormonal things, whatever it may have been. But I finally called a neurologist, Stephen Sykes. You may know him, but
yeah, I've heard of him.
Yeah, good dude. And he was like, "All right, we're gonna put you on a calcium channel blocker. So I go on this calcium channel blocker. I was like, great. Now I'm only getting them breakthrough once a week during the day. I could live with that. And I was like, you know what? There's a acupuncturist who I've used in the past. Let me call him.
Mm-hmm.
I went and saw him. He's like, I got you. We started doing acupuncture. We started twice a week. Now we're down to once a week. I haven't taken a medication or had a headache in over a month.
At what point during the treatment did you notice that it had an effect?
Almost probably after a week.
1 week?
Yeah.
How many sessions?
2.
2 sessions?
Yeah.
So it can be very effective.
Oh, it can be extremely effective in the right people.
When do you think acupuncture is the most effective? Like which cases? Like that you find I refer and I just hear your problem's gone.
Everybody.
Really?
I refer.
You think it has an effect?
It's either, I always tell people it's either helpful or it does nothing. And I always tell people, you either know it's going to help after 3 or 4 sessions or not. Don't just say 1 session and it's
you got to go and
you got to go for. I tell people go for at least 4 sessions.
What percent is done nothing, and what percent is like it was helpful?
75%.
Even if it was short.
75% say it was helpful.
75%. Wow.
Of my patients say it gave them some relief. It wasn't lasting.
Mm-hmm.
I would say 90% said it at least helped the day of and the day after.
Something.
Yeah.
Sometimes that's helpful too. Just so
and
you can
it's practitioner dependent, just like doctors.
What does it feel like to have no pain? Some people are just like, just give me a day of that. It's like, oh yeah, that's what it's like.
And it's practitioner dependent too, if you think about it, like doctors.
How do you use diagnostic exam versus using interventional exam, like diagnostic treatment injections? Do you use those? Do you use those to make decisions? I don't use them. I use physical exam and imaging always.
I use physical exam to make a history.
Yeah.
Tells you, 75% of it is what you find out in the history. The other 20% is your exam. 5%, I order MRIs and X-rays to verify what I'm already thinking.
Pretty much always getting some objective imaging.
Yeah.
I mean, if I'm operating, I'm getting objective imaging.
And I order it because I'm like, I think this is your problem. I'm going to get an MRI to verify what I think.
Very similar.
I don't do an MRI to tell me what the problem is.
Yeah.
And we're back live on the LA Shoulder Podcast. We had a brief interruption. We had to change tequila. We ran out of Mandala, the said sponsor of our podcast, my podcast. But can you give me that Mandala tequila there, buddy? Andrew? What guest were you, Andrew? Which number were you? Were you the second?
2, the trial.
You're the trial guest. You're the backup guest. This I'm gonna have right here, LA Shoulder Podcast written, and they sent me a picture. They're gonna print it on there.
No kidding.
Yeah.
We'll have to talk about that.
Grant Stone, he's my uncle.
Mm-hmm.
He's not, but his name's Grant Stone. He's my big uncle. He's one of my distributors, and
nice.
He's good friends with those guys. So they're like, "You're sponsoring the show, right?" I'm like, they're gonna send me a bottle. So,
nice.
But guys, I'm out. We're out. We got to finish it for sure tonight because I need a new bottle. So I think we got to cut off a little bit, but Andrew's going to keep an eye on the red lines. Make sure it stays red, Andrew. So if it turns blue, that's bad, okay? But yeah, we've been up and running a little bit. This is an independent show, independent podcast. Dr. Hunt, you've been doing your show for how many years now? You have a very significant production.
Almost 3 years.
Tell me about that show and about kind of like how you started in terms of you see what I'm doing here.
Yes.
It's pretty rough and cut independent, but where are you now and how did that grow?
Yeah. So we started out by buying a roadie podcaster. So we're talking about the podcast. So
yeah, we
started out buying the equipment, a whole setup just from a roadie podcaster, mics and all, and recording at my house.
Pull up a roadie podcast and see what that looks like.
Yeah, and it's a easy
little 4-channel.
Yeah, and we're like, you know what? Instead of trying to figure out how to do it, let's just start recording. So we just started having a conversation, and as we went on, we're like, huh.
Did you guys do video from the start?
No,
just audio.
Just audio from the start. Then we started plugging in the iPhone and using that.
Sure.
And we're like, let's start throwing this up on YouTube.
Yeah,
and
not too hard. Not too hard. I can do this.
Okay. And as time went on, we got better and better at the sound quality. And
that's cool. So you guys really started the production yourself.
Yes.
Yeah, that's how
it all
figured it out.
Yeah. And it wasn't until this year that we moved to a studio.
Really?
Yeah. And
where's your studio located or based out of?
Melrose Podcast.
Oh, in
Melrose
LA.
Studios on Sunset. Yeah.
Oh, very
plug
cool.
to them.
Do you guys have? Is it your studio?
No, we rent it for a specific time. They provide everything else, and by the next day, fully edited, fully ready podcast.
Should look up their Instagram. We'll pull them up because I'd be interested in checking out some studio space.
We checked out a bunch of studios, and that was and you can book time 24 hours a day.
Oh wow!
7 days a week.
Do you know what their Instagram is? What's the name?
Melrose Studios.
Melrose Studios.
No podcast. Yep.
These guys?
Those guys.
Mm-hmm. Like that hair?
No. That's the studio they're recording in.
Oh, I see. Melrose
Podcast. That's it.
Oh, cool.
That's their IG.
All right.
Yeah.
We'll blow them up. Blow them up? No.
Yeah, but no, they. And so the quality, it's a 3-camera setup.
Yeah.
And
so you guys just show up and you go.
And so we show up, record. They send us, and there's different packages to the point where they'll even do social media pushes for you if you want ready reels. I'm just like, dude, we just need the edited podcast. We tell them the clip, like the section where we talked about shoulder and neck. Let's put that as the teaser clip at the beginning of the podcast.
Mm-hmm.
And they're like, all right, cool. And it's done literally within 24 hours. We get the whole thing sent back.
Yeah.
And then we edit the beginning, the intro, the outro as we see fit and done. Whereas before we were doing it all.
Mm-hmm.
And I was just like,
I'm
not trying to do that. It's worth spending that money to do this podcast. And then when I walk out of the studio, I don't think about the podcast till I walk back in the studio in 2 weeks.
Mm-hmm.
And then my partner in the podcast,
do you listen to it before it's released?
Nope. I used to listen to the old ones.
You listen after?
I haven't even listened to a podcast we've done in the studio
yet.
Just
do it.
I was there.
Yeah.
No,
of course.
I'll hear little clips that we throw up on social media, but
mm-hmm.
I don't want to. I may go back and listen to a couple of them, but it's on to the next.
So it seems like it's something you're going to continue to do.
Oh, yeah. We were talking about how we started in my living room and just building up to the podcast and then going to the studio.
Yeah.
And the advantages of the studio, number one, I can bring in guests that aren't my friends.
Right.
Because I don't want random people in my home.
Right.
You know,
you're my friend. It's okay.
No, that's what, you know what I mean. But what I'm saying is, people I don't really know,
of course,
or that are patients of mine, or people in the entertainment industry that I'm not really friends with. I am, but I'm not. And the studio makes it easy because, like I said, 3-camera setup, all these different things, and they can piece it all together. I'm a doctor. Let the professionals do what they do.
Right.
It's been great being able to do this on our own, but after a while, you kind of want to just outsource, like we talked about, and be the doctor. You want to be the talent.
Well, that's why I asked you about your time management, because I and that was one thing I learned from your show for sure, was about, hey, you got, how long are you going to work for? 8 hours a day. And you got 16 other hours, and you're going to sleep, and you're going to sleep for 8 hours. And you have this much time that you're not working. What are you doing with that time?
What are you doing with those 8 hours? You know, for me,
you could do a lot of stuff.
Yeah, and then you think about the weekend. Think about it. You think about the weekends. You got 16 hours each day.
Yeah, you could do a lot of podcasts.
You know, and so for me, because I do a lot of international work, I find myself on Zoom calls and doing phone calls at 2 a.m. because it's 2 p.m. in Africa. You know,
how much do you do spend time doing traveling for the Hunt Foundation?
Not as much as I did pre-COVID. Because now what I've realized, the Hunt Foundation, we've taken sort of...
Can you pull that up, the Hunt Foundation, so we can look at that?
We've taken an approach now...
Are you recording? Yeah, just screen record it so we can look at it. Yeah.
We've taken an approach now where we initially started by, we're spine surgeons, let's go do spine surgery. So if I go to, say...
Larry Dorr did Operation Walk, I know, at USC, and it's similar. It's a philanthropic work, international.
But I'll tell you one thing that I realized. If I go to, say, Ethiopia, and I see 150 patients in a couple of days, and I do 20 surgeries, I've helped 20 people. If I provide equipment and medicine and hospital beds, and I provide education for kids, I've now helped a population of 190 million. Spine surgery alone versus all the other things. Like recently, civil war in Ethiopia, the northern part of the country, something as simple that we take for granted. Soldiers and civilians had ostomies from wounds. but they were using
gunshot wounds.
Yeah, they were using
wounds.
plastic bags to cover their ostomies.
Mm-hmm.
So they approached us and like, hey, we need colostomy bags. Shipped 10,000 of them from China to Ethiopia and just doing those logistics. But
you can help direct what's needed from a medical perspective.
Exactly.
Yeah.
One of the most recent projects we did, we got approached, and this is what I really want to talk about, this one aspect. We got approached by a school for the deaf, and there's 67 young girls there who, during the time that they're going through their menstrual cycle, would stay home from school because there's no pads, tampons, and all of that.
I have no resources there.
And so what we did, we were introduced to a company that makes reusable pads, and it's a little startup in Ethiopia. So what did we do? They asked us, will we supply these for these girls? We're like, yeah. They're like, will you give us a 6-month supply? I was like, sure. But instead, why don't we give them a year supply? Why don't we give them undergarments as well? And then why don't we do this now, every year from now on?
Help them.
What does that do?
Yeah.
These girls don't miss school.
Mm-hmm.
They get their education. They don't become marginalized in society. They already have a disability because of the hearing issues.
Mm-hmm.
And then now, they
need support.
Yes. And so this one little thing that we take for granted, we're like, this is simple. Things that I can spend money on and make a difference, that's easy. I don't have to be on the ground.
It's hard to know when your money makes a difference, and so I think when you have somebody behind a good organization and they're out there actually doing that work,
yes,
it's something that you can say, oh, this is the work that's being done. And so that's a little bit more direct, which is nice for people to contribute to.
Yeah. And our foundation has no employees. And so
is it a nonprofit?
It's a 501c3, yes. And so what we do, every dollar that comes in goes directly, like for example, one of the hospitals there.
Go ahead.
We took, imagine Cedars Central Processing, where we sterilize equipment. Cedars they may not like this. They were up for renegotiation with the company that makes all the sterilizers and all that stuff.
Mm-hmm.
That company, Cedars gave me that information. And that company, I called them up and I was like, hey, we're building a hospital in Ethiopia. We're interested in doing something similar to what Cedars does. They thought by coming to me that I would put them in the good graces with the hospital. I tried to tell them, I don't have any say in what Cedars buys.
Mm-hmm.
They ended up giving us a quote and building all the equipment. It was a company out of Sweden.
For getting the instruments sterilized.
Yeah, so autoclaves, washers, ultrasound machines, all of those things.
It's critical. Otherwise, you cause infection. It's like we got to keep stuff clean.
The hospital we were working
in
over there had an old gas sterilizer from the 1930s.
I'm sure. That's the number one concern surgeons have is stuff clean when I show up.
Right. And so they gave us a quote and said it's going to be $111,000. So what did we do? We raised $111,000.
Sounds manageable.
And made a wire transfer immediately. There was no. All my friends who were in business were like, you can take a salary, you can do this. I was like,
cut that. Yeah.
I was like, no. So we did that. And so when people, they trust us because they know there's no money coming out of the foundation to fill pockets.
Right.
All the work done by the foundation that's administrative, we do it and I pay my staff out of my own pocket to do it. So every dollar that comes into the foundation goes to where it needs to go.
And are you looking to build the foundation? Are you looking for more volunteers? Are you looking for more surgeons? What is the future for the Hunt Foundation?
Just growth. The more people we can help, the better. And it's not just, people are always like, oh, I want to do a mission trip with you. This is so far beyond mission trips.
A lot of people are interested in that. Yeah.
And I
am,
feel,
by the way,
right.
If you want to go, when's the next time you're going? I'll go.
Don't know yet. And so the thing is, the thing is,
it's
it's so much more than mission trips because it's your expertise could be used virtually to help their surgeons do better surgery. The teaching aspect was like we set up a plastic surgeon there with a crew of hand surgeons. So Culber and those guys actually are on an email chain and weekly exchange of information to guide him through surgeries. And so that is so much more helpful than going over there and operating on 10 shoulders.
Right. And you can just go back to work over here and you can help this guy when the time comes.
Exactly.
It's a lot more better use for your time.
Exactly. Because it's a big ordeal to make those trips. And when we had one patient who she was in bad shape. So we flew her here.
Mm-hmm.
I had one of my patients who put the family up in their home for the week she was here, a young girl we did a scoliosis surgery on here.
Mm-hmm.
And we had Ethiopia Airlines fly her out here. I mean, it was a process, but she got here and fixed her up and sent her back.
Yeah.
And got
How long did she stay after the operation?
She stayed about a month, maybe 3 weeks, because she also wanted to go to Disney.
Of course.
Which tells you something. She had a big scoliosis surgery.
Yeah.
And ended up coming to go to Disney.
That's great.
She didn't jump on all the rides and all that, but she got to see it.
Right.
And how important, how crazy is that?
Yeah. And front of the line too.
Yes.
So, special charity.
She spent 2 days in the hospital only, which is wild. Which tells you something about pain control from, you operate in Ethiopia and all you can give them is ibuprofen and Tylenol.
Kind
There's no narcotics.
And some kind of weird medication that they're like, this is the local pain medicine.
They do
that's
just fine.
opium.
But so it's the foundation has done a lot of good things, and we continue to fly under the radar and just help people as projects come across. We just got approached to do a project in Ghana to help with kids who need prosthetic limbs. That's easy. We're going to have those conversations, and when they pop up and we come up with a plan, then we start getting these kids the limbs they need. And so we're spreading our footprint across the continent. People are always like, well, why Africa?
Yeah, I was going to ask what the mission of the foundation is.
To take medicine beyond our borders and just provide education and healthcare to those who normally wouldn't get access. A lot of people say, why don't you do things here in the U.S.? And I say, if you live in the U.S., you can walk into any emergency room and get healthcare.
Well, you're doing a lot here in the U.S., Dr. Hunt. I would say you're doing a lot of good for the U.S. population already.
But people say, why doesn't the foundation just do it all here? I'm like, because the access we have, you might not be able to pay for it, but you'll get it. In Ethiopia, there's a cashier outside of the ER. If your family doesn't pay for your treatment, you don't get the treatment beforehand.
Yeah, what is the amount of impact that you can have by doing that type of work? Maybe very significant for a lot more people or for those people's lives.
It's a ripple effect.
Yeah,
you help one,
and you can inspire younger generations.
You help that one person. That one person goes on to help countless others, and so it's that trickle down effect. You don't know the impact you make, so try to help at least one. People think you have to make a grand gesture or none at all. To help those 67 girls, it cost. For a year's worth of sanitary pads and underwear, it costs $450 total. That's a night out to dinner. You know what I mean? If you think about it, if you put it in that,
right, you have a major impact.
Yeah, but right you've now affected the lives of these kids that you can't even imagine. They now will not miss school. They're going to become productive members of society. They're going to go to school. They're going to go to work. One of the biggest projects we're working on now, and I'll tell you this real quick. We teamed up with an organization called Ethiopia Skate. And some professional skateboarders from here went over and built skate parks.
Ethiopia
Skate. Yeah. They went and built skate parks. And so they wanted to start with tutoring kids, et cetera. And so they approached us and was like, hey, how do we do this? Cool. Set up after school tutoring for the kids who are most vulnerable at this school. And then on the weekends, tutor them as well, but also involve them in skateboarding and other activities. And I was like, okay, that's cool. You're thinking too small. It's like, think about why they're not excelling in school. What's their home life like? Oh, a lot of their parents lost their jobs during COVID, this and the other. I was like, so how about we do this? Why don't we feed these families for 6 months? Why don't we send their parents to vocational school and then pay for job placement for them? And we can do that 6 months at a time. And that way you're now protecting the entire family.
What area was this?
This is in Ethiopia.
Ethiopia.
Yeah.
I see.
And so we were able to set this program up, and it's been running this past year, and we're slowly integrating more and more programs for that. Because think about what that does. You're now educating second, third, and fourth graders who are going to grow up to take care of this population.
Do they kids learn to skate?
Yeah, they learn to skateboard. They do all of that. Yeah, they love it.
Kickflips and stuff.
And what people don't realize is that charity work, complete charity work, doesn't work. It's not sustainable.
Right. It's got to be cool a little bit.
Not only that.
Something cool.
Well, no, it's not
like
only
skateboarding.
That. Well, no, it's not just
like,
that.
hey, do I learn to skate? Like, yeah, okay, I'll teach you. Like, I'll teach somebody how to surf. Like, it kind of makes sense.
Well, many studies,
a little cool.
Yeah, but many studies have shown when you do something for charity for free all the time, it doesn't work.
It's not sustainable. Yeah.
So what do? You teach people to take care of themselves. That's the goal. You're not going to go change a community by doing everything for them. You change a community by giving them the resources to do it themselves. and make it finite. It's not a forever plan. It's I'm going to get you over the hump so you can do it yourself.
Not a forever plan.
No.
That's the key. You're not going to change the whole world, but let's make small steps for that population, for this group of people. You know,
I've now
mentorship.
given you your tools.
Yeah.
You can now make jobs. I've taught you how to sew clothing. Now you can sew your own clothes. I don't have to buy you clothes. Give you a skill so you can take care of yourself. When we were going over there doing surgeries, we would make their surgeons scrub with us. So that way they're learning to do what we do and teaching them how to do what we do with the equipment they have, not all the fancy stuff we could bring that we're going to take home with us. That's the difference.
I think that can be real power. And power is a word that I heard defined as having an effect at a distance. You don't necessarily need to be there necessarily, but you can still have an effect. That can be real power that you're instilling in another person that they can then take with them, that they go on without you there.
Your simple words are powerful.
Yeah. And and then they can live a different life that may help them, and then they can teach somebody else similar things. Hey, there was that one guy that taught me that one thing that one day that was really helpful for me.
Or I see this one guy, what he's doing.
What was his name? Dr. Hunt. He was cool. He had
right?
good tattoos.
I mean, right? Think about when somebody sees you do a random act of kindness.
Yeah.
And then
Makes
they
a big
go
impact.
do
It can.
they go do and do something.
Yeah.
Because they saw you do
I
it.
saw Trump handing out French fries at McDonald's.
I saw him holding a Bible in front of a church. Made me want to go make
Playing it
Bibles.
out, yeah. Well, you're an inspiring guy, man. And I think like for me, I feel like there's people that come to me like, wow, you do so much stuff. And I'm like, yeah, I do cool stuff. But I look at you and I'm like, wow, you do really cool stuff, you know? And I think you've been doing it for a long time.
Yeah.
And for somebody like me to look at somebody like you as a mentor, you know, in multiple realms, podcasting, we'll say, kind of, as a surgeon, you know, as like a really cool guy. I need more tattoos also. So, you know, we have a lot more there, I think,
Got a
for a
great
long
artist for
time.
you.
So yeah. Oh, who is it?
Oh, Donatella Azagas. She's phenomenal.
Donatella Azagas. Make a note of that.
Yeah, she's
Make a note of that, Andrew. We're all getting tattoos
I'm
together next
7
time.
deep.
Yeah, we're going to go LA Shoulder Podcast tattoos again next one.
I'm 7 deep with her. She's phenomenal.
Do you have an Instagram?
Yes, at Leonel Hunt.
At Leonel Hunt. And do you have a website?
Huntspine.com.
Huntspine.com.
Yeah.
Mine's michaelstoneshoulder.com. So
like
we have
it.
we're living parallel lives. Stone Shoulder and Hunt Spine. Well, man, yeah,
and if
anything
you
else
want to
wanna
go
bring
check
up?
out the podcast, podcastsoe.com.
SOE.com.
Podcastsoe.com.
Podcastsoe.com. We'll put it up at the end. I'll put little links and stuff there.
I'll tell you the IG for it will be SOE_podcast.
SOE_podcast.
Yeah. And that's everything else.
Man, that's so awesome. Sipping on excellence. It's
Yes.
been so awesome to have you, Dr. Leonel Hunt. You're a good friend and good partner.
man.
And I hope to have you on again someday.
Absolutely.
Yeah.
Would love to, man.
Awesome, man.
Yes.
Good
Thank
having you.
Definitely.
All right. That's it. That's all, folks. See you next time on the LA Shoulder Podcast.